Dr. Inns. I'm one of the general practitioners here at Coverly Med. Nice to meet you. Mrs. Parker, is that it?
Yes.
Okay.
Tanya
okay
Parker.
if I call you Tanya? Okay,
Yeah.
wonderful. Thank you.
Yeah.
So today I'll be asking you a few questions. So ma'am, what seems to be the issue? Why are you here today?
Well, I took some pregnancy tests and they all came back positive, about 5 of them.
Took about 5 of them.
Yeah.
Okay, so when did you start to notice or suspect that you were pregnant? When was its onset?
Okay, so about my last period lasted about 3 to 4 days
Yeah.
normally, and then right after that I did not see my period again, like for this month. It's
Okay.
been like 6 weeks in between now,
Yeah?
and then last month wasn't even that much. It was just like spotting,
Spotting.
so it was quite irregular.
Okay, so it was 6 weeks, right?
Yeah,
6 weeks ago, right?
It was 6 weeks ago.
Okay, and you didn't have one for this month?
Not at all.
Not at all?
Not yet.
Okay, so at what age, do you remember what age you had your first period?
I had my first period around I think it was around the age of 14.
14. 14, okay. That's a normal age.
Yeah, it is.
So your menstrual history, tell me a bit about that. Are your periods regular, irregular? How long do they last?
I've usually not had any problem with my period. My period usually lasts about 3 to 4 days every month.
Yeah.
But then my last period was just about 1 to 2 days of light spotting.
Spotting.
And then on the norms, I would use about 4 to 5 packs per day.
Pads.
Yeah, of pads per day.
So do you usually have any pain with your periods?
Oh, none.
Cramps?
None of that.
So have you experienced any spotting between your periods, like any unusual discharge?
Well, usually no.
No? So you and your husband, do you guys use any method of contraception, any birth control?
So we use like the safest one that we know, which is pull-up method.
Okay, natural method.
Really natural method.
Okay, nothing wrong with that. So have you had any previous pregnancies, miscarriages?
None of that. None that I know of. So none of
None.
that. Yeah.
Okay, wonderful. Besides your husband, do you have any other sexual partners?
Oh, not at all. I'm only sexually active with my husband because
No history of STDs then? Any?
none.
No. Lately, have you been nauseous?
I mean, no vomiting of any sort,
No.
but I felt like irritated, nauseous and all of that.
Okay. I
whole
see.
roller coaster and all of that.
I see. Do you usually have bleeding after sex? Any spotting?
None of that. No.
None of that.
No. Not at
Okay.
all.
Okay, so that's normal. Any abdominal pain lately?
No, I usually barely have any abdominal pain of any sort. So none.
Okay.
None of that.
Okay, appetite change lately? Have you craving anything in particular? Is it
No cravings of any sort. It's actually quite the opposite. Like I don't feel like eating anything. Just like the smell of food just sends me into a whole retching episode. It's like I want to throw up.
Not even Chapette, huh?
Not even Chapette. Oh my god.
I'm so sorry.
Yeah.
And how about weight changes? Have you noticed any changes?
I mean, recently I haven't checked my weight, but my husband did make a comment like some days ago that he looked a little bit thicker, and I've been feeling a little bit bloated recently.
I see.
A lot.
A lot.
All I want to do is just sleep. I cannot even get to do my daily. No, you know what? That's just been going too far.
Yeah.
Just to leave the house this morning was an entire episode of
Yeah.
should I not?
Yeah.
All of that. It was,
I understand. And you feel drained.
yeah,
all throughout the day.
exhausted. Like,
Do you notice any changes in particular with your breasts? Are they tender? Do you have any discharge?
none of that. It's just that my breasts have felt a little bit full.
Yeah.
I'm kind of scared that it will get so full now that even my breasts can't even fit.
How about a last pap smear? Have you had any?
If I do remember correctly, it was like 8 months ago, and it came out. Yeah, the doctor said it was totally normal.
Have you had any fever lately?
Oh no, not at all.
How's your bowel habits?
Well, I usually go once a day.
Once a day?
Yeah.
Okay, that's pretty normal.
Thank you.
That's really good. And so you drink a lot of water?
Yes, I drink a lot of water. Well, not too much water, but I regularly drink water. And recently, I've been going to the bathroom like very frequently to urinate.
Yeah. Okay, noted. So do you experience any shortness of breath? Are you feeling like
Oh,
when you
no,
walk up the
not
stairs.
at all.
Awesome, that's really good. Has your skin changed? Have you
Well,
noticed anything?
I do have an amazing skin, so
Right.
I haven't really like noticed anything different.
Oh,
I
okay.
have an amazing skin.
Okay, so you look very fit. Do you exercise often?
Yes, I run about 5 miles per day.
5 miles per day?
Yeah, but recently because of the whole like fatigue and all of that, I've just
Yeah.
been feeling so under the weather. I did check Google, and Google's like it's because of like the
Oh,
weather
Google.
change and all of that.
I
yeah.
see. Google.
Yeah.
So do you take any meds? Any medications?
Not any serious meds. I do use multivitamins though, just to
Oh, so you take
make sure I'm
multivitamins?
healthy. Yeah.
Okay, that's wonderful.
Mhm.
So no like painkillers or nothing
No,
like
no,
that?
I'm very healthy. No pain of any sort. I'm agile and all of that. So just use multivitamins to keep it
Yeah.
that way.
That's wonderful. That's really good. Have you had any like diseases, any scares in the past?
Nah, I'm very healthy. I've been living healthy, so no
Okay.
bad.
Wonderful. So have you had any surgeries then?
Well, I did get my appendix removed when I was about 20. That was about 8 years ago. Yeah.
So what about your mom and your dad?
Well, they're the reason why I live healthy because my dad has diabetes. He's
Okay.
obsessed with sweet things.
Oh,
And then
wow.
my mom has obesity
Yeah.
and she has issues with her thyroid too. So
Okay.
you can understand why I decided to live healthy.
Well, that's remarkable.
Thank
Honestly,
you.
that is. What do you work as? What do you do?
Well, I don't work. I'm a graduate student, so
Yeah.
I hope that after my graduate college or whatever, I could get a job.
And you're hoping to get.
Yeah, I am.
Okay. So alcohol use. Do you drink often?
Well, I wouldn't say. Well, I do drink. I drink about 1 to 2 beers a week, but not too much. Just 1 to 2 beers a week.
Okay. So any illicit drug uses in the past, present?
Not at all. I'm not into all of that.
Okay. So no cocaine, no.
No.
Okay. How about smoking? Do you tobacco?
No, I don't. It's not good for the lungs. I'm trying to not.
That's wonderful. That's wonderful. So do you have any drug allergies like penicillin or like paracetamol or any of those things?
No, I don't.
Not if you don't.
No, I don't.
Okay.
I don't
Okay,
have
that's
any.
wonderful. So is this a planned pregnancy, ma'am?
Oh, it's not. Unfortunately, it's not.
Okay. So did you desire to get pregnant?
Well, I'm not really sure about that. I mean, I'm not sure I want a child now. I mean, looking at the fact that I'm still in school and it's my first year in marriage, it's kind of like there's a lot to like get going and to be tied down by a child. But
Okay. Okay. So one last question: do you experience any domestic abuse?
not at all. Like I said, my husband is quite a sweetheart. I mean, it does try to get on my nerves sometimes, but it's just so cute. Like keeps trying because I do not want to get angry.
That is so wonderful to
Thank
hear.
you.
So, looking at everything that I've recorded here, it appears that you might be pregnant, okay? So, we'll have to run a few tests, a urine test, we'll have to, do a pap smear and all those things, and, the spotting that you experienced the last 6 weeks, actually that's quite common, in the first trimester of some pregnancies, which is why that's why it was important that you told me that. And of course, natural methods, of course, the pull-out method as you described, it's not 100% effective as other contraceptive methods. So these are things that make me, assume that you might be pregnant. And of course, we'll do the test. We'll do an ultrasound. We'll do some blood tests. We'll do a pap smear. We'll check for any infections. So just make sure that you're okay. And so I'll give you a multivitamin to take and some prenatals, and we'll just see where we go from there, okay?
Alright.
So thank you so much, and I will advise you further, and I just want to hear from you now.
Well, I mean, I'm not sure my husband and I want to keep the baby, so I don't know what you would advise me to do.
Okay, well, that is quite common and it is quite okay, and I understand that. So, and I understand that you're anxious about this. So, just know that as your healthcare provider, I'm here to support you in whatever decision you make. And I would advise you to have a talk with your husband first, figuring out this information, when we get the test, and we'll see where to go from there, okay? And of course, I will discuss other methods and other options for you. So, yes, thank you so much.
Thank you very
And
much.
there's no need to worry, Mrs. Parker. Thank you so much